Good afternoon, everyone, and thank you for joining us today to our media advisory. As per usual, I'd like to welcome Dr. Elizabeth Richardson, our Medical Officer of Health, and Paul Johnson, the city's Emergency Operations Center Director. But before we get started, just a reminder that Ramadan starts tomorrow, Tuesday, April the 13th. And for Muslim members of our community, this is the second Ramadan they will be observing during the pandemic. The pandemic presents the challenges for observing Ramadan, and we thank you for observing all of those Ramadan festivities safely and virtually. But it does not change Ramadan's meaning, which is prayer, reflection, generosity, compassion, and service to others. And many Muslim members of our community are on the front line of Hamilton's pandemic response as nurses, doctors, and essential workers. And your efforts are appreciated and valued and honored. And thank you for everything that you do. And to everyone else, Ramadan Mubarak. As you know, we are now under a province-wide stay-at-home order for the next 4 weeks. The situation in our community and across the province is very serious, with ICUs or intensive care units filling up and hospitals ramping down all non-emergency surgeries to preserve the ICU space for COVID patients. And I know the provincial stay-at-home order is not great news for many of us. However, we are experiencing that surge in COVID-19 cases with variants that are very concerning, more contagious, and potentially more harmful as well. And so these additional restrictions need to be implemented to help lower the spread of this virus. So under the stay-at-home order, everyone is asked to remain at home except for essential purposes such as going to the grocery store or pharmacy, accessing healthcare services, including getting vaccinated, of course, exercising outdoors, or for work that cannot be done remotely. Individuals are asked to remain in their local communities as well and avoid all essential or non-essential travel, even within the province, and to stay at home when you're feeling ill, even with mild symptoms. So we are seeing some impacts to city services as a result of the stay-at-home order, and Paul is going to walk us through those in a few moments. But before I hand things over to Paul and Dr. Richardson, I just want to take a moment to thank some of our emergency responders who work behind the scenes each and every day. This is National Public Safety Telecommunicators Week, honoring the talented communicators, call takers, and dispatchers who support emergency response efforts. To those dedicated individuals who answer our emergency calls as first responders, you are the unseen frontline heroes and are often the first contact during a crisis situation. So thank you for all you do to keep our community safe. The Hamilton sign will be lit up red and blue this week in recognition of that acknowledgement. And again, as always, you can go to the hamilton.ca/coronavirus website for a more fulsome list of restrictions under the stay-at-home order as they are today. Thank you to everyone who continues to do your part for following our public health measures. You are making a difference. Let's keep it going. I know it's difficult, but the challenge is before us, and I know that the City of Hamilton is up to the challenge. I'm going to pass it over to Paul Johnson, who's going to talk to us about some localized citywide issues that are impacted by the stay-at-home order. Paul?
Well, thanks very much, Mr. Mayor. And just to pick up where you left off, and thank you very much for recognizing those who are in communications, and in particular dispatch work and emergency services. I, of course, work very closely with the fire department, our paramedic service, and I actually have a dispatch radio that I can listen in for fire, and to listen to those professionals do their job. I think people feel the call comes in, they dispatch somebody to the call, and that's the end of their work. But in fact, they continue throughout the whole event. And the professionalism and the work that they do to help keep people safe from their end and make sure they have the right resources I just want to add to your thanks for all of those folks doing their job. Of course, as we are in the stay-at-home order, there have been some impacts to city services, and I'll go through some of those today. Our municipal service centers, City Hall, and our service counters are closed to the public, and in most cases now are no longer accepting in-person appointments for any services. There are a couple of exceptions to that, and I'll get into that in just a second. So this would include all the things at our municipal services centers at City Hall. If you're coming in for certain licenses or coming in to get blue boxes or some of those work, our animal services desk, our licensing desk, clerk services, and so forth. So those are no longer available for in-person appointments. The buildings are closed to the public. Most of our services are online, or you can access them by phone. So we encourage everybody to go to the city's website, and you can either do the services through there, or if you need to contact us by phone, and somebody will be willing to take you through most of those. There are a couple of things where it can't be done over the phone or online, and we are going to keep those open as exceptions for in-person appointments. One of those is for marriage licenses. So where there are special circumstances that require a marriage license during the stay-at-home order period, please call the city, and there will be arrangements made for that to happen. Also, our provincial administration offenses office will remain open for in-person appointments for filings only. So if you need to file with our provincial administration offenses office, you will be able to do that by appointment as well. But for the most part, please go to the web. Please go access us by phone, and we will help you do as much of the business you need to do with the City of Hamilton as possible. We've also postponed after meetings and discussions at the EOC or modified a couple of our spring events as a result of moving into the stay-at-home order. The spring compost giveaways for the City of Hamilton will be postponed until after the stay-at-home order is lifted. So we anticipate it will still occur, but we are not going to, it was to occur later in April. It will not occur until the stay-at-home order is lifted. All community tree planting events planned for the spring will be postponed also until the stay-at-home order is lifted. Private tree giveaways will continue through the stay-at-home order, but they're going to be modified so that the trees are dropped off at a resident's home in a contactless delivery system, so there'll be no interaction with the public. We want to continue to encourage the cleanup of our city parks and neighborhoods. And after a lot of discussion at the EOC, because of the tremendous value this brings to the city, and the fact that if the residents of this community who want to keep their parks and their neighborhoods clean are not able to get out and do some of that work, it means additional cost to our city. We have modified our approach, but are still encouraging these to happen where they can be done safely. So if you do want to be part of the Team Up to Clean Up, Adopt a Park, or the Beautiful Alleys program, we will be requiring mask wearing of all participants, and participants need to be from the members of the same household or an individual working alone. So not several individuals getting together, but if an individual alone wants to do a little bit of cleanup, that's fine, or members of the same household can get out and do a bit of that cleanup. We're going to encourage that. We do have some supplies that we can make available to help in this, and all of this information is available on our web as well. For those who require replacement of in-home water meters, this is moving to an emergency service only replacement until the stay-at-home order is lifted. I'd like to remind the public that HSR, all of us should be traveling for essential purposes only, and the HSR wants to make sure they can continue uninterrupted services. And again, our public transit should be used for those essential pieces of travel only. Our enforcement of COVID-related activities continues. We continue just to shift as we move up and down the color bands, or in this case, into the stay-at-home order category. And local enforcement is out every day of the week at all hours of the day. This past weekend was an unbelievable number of calls that came in from residents reporting illegal gatherings, businesses not adhering to rules, people not wearing their masks, and other infractions. Although there were no commercial charges that appear on our website, we had a number of charges laid to individuals. Some of them were not COVID related. They were folks that were enjoying our waterfall areas and entering prohibited areas or trying to climb the waterfalls, and encourage people not to do that. But another large number of violations occurred under the Reopening Ontario Act, and also for residential activities which were outside of the requirements under the stay-at-home order. This included some people that enjoy automobiles and got together for a bit of a car lovers gathering inside a garage. And just a reminder that garages are not outdoor facilities. Even though the door can be opened up, that doesn't turn it into outdoor activities. It remains an indoor facility. But there were also family gatherings, including this weekend, baby showers, birthday parties, and other family gatherings that had our officers arriving at these residences and laying some charges. So it is a reminder that you're not to gather indoors outside of members of your own family unless you are a single person or a single parent, and then you may exclusively connect with one other household. And this is really to protect all of us. It's not there to, we're all feeling the pinch of this, and we want to encourage the activities that can work. I'm going to get to some good news, I think, on that front in just a second. But the activities that are high risk, the activities that are actually can drive some of the increased cases in our community, we simply have to hold off on those until it's safe to do so, and a recognition that people are watching in this community and our bylaw officers are responding. Just in terms of other pieces of enforcement, we get asked these questions. So just to calm any nerves that are out there, the police or our bylaw folks are not stopping people in cars, stopping them on the street, asking them where they're going under the stay-at-home order. We expect that people are respecting the fact that you're going out to do essential work only, but you're not going to be stopped in that. We are focusing on the things I just talked about, those private gatherings, businesses that are not following the regulations, our mask policies, and our physical distancing bylaws that are in place as well. And so we're trying to keep everybody safe in those higher risk activities, but we are not trying to police everybody's comings and goings as it goes. And then a friendly reminder, as much as you may be concerned about COVID-19 and its spread, it is inappropriate, and you should never call 911 to report an infraction related to COVID-19. Call the city at 905-546-2489 or 546-CITY, as we say, and you can log the complaint there. But please do not tie up the valuable resources of 911 reporting a party next door. Our recreation folks, as you have heard, have been preparing themselves for the summer and a chance where we hope to see more activities in our community, and getting people outdoors in particular and enjoying recreation, enjoying chances to be together in a safe way, and particularly for children, a way for them to have interactions around so their development improves, their mental health improves, and they get active. So Camp Kadaka is back. As you remember, last summer, we canceled our Camp Kadaka program run through our recreation program. It is back. And we will offer full day registered 2-week-long day camp programs. Now, of course, we'll offer these if we're allowed to, but our sense is that we want to plan and be positive that by the summertime, there may be the opportunities for these day camps to operate, and we are fully preparing for that. And so that's a bit of optimism within our staff teams, and hopefully a bit of optimism to share here today. The programming will begin on July 5th and run through the course of the summer. All sorts of great activities, and the registration for these programs will start on May the 5th. And you can go to the website again, hamilton.ca/Camp Kadaka, and all the information is there. And so I know some people will say, well, today, as we talk about the seriousness of this pandemic, you're talking about summer camp activities and getting out and enjoying activities. And I think it's important to do both, to encourage us to continue to look forward to things that may happen in the future and do safe things in our community today, alongside recognizing that the things that we are encouraged not to do and the things that we know are high risk activities should be struck right off our list. So thanks for allowing me to give a bit of those updates today, and I'll pass things over to Dr. Richardson.
Thanks very much, Paul. Still going to go through the cases, talk about the vaccines a bit. 14,238 cases locally today, 134 more than yesterday, which includes 1,286 total now local screen positive variant cases. We're now sitting at just over 60% of our cases having a mutation or a variant of concern when we look at the cases over the last 7 days. We do have 1,028 active cases now in Hamilton, a total of 334 deaths, with 2 new deaths having been reported today. In terms of outbreaks, we're sitting at 48 local outbreaks on our website, with 1 new outbreak that was reported today. That's at Harvey's at 724 Queenston Road. Our weekly incidence is sitting at 139 per 100,000, and our reproductive rate this week sat at 0.94. So as always, you can find more details about our local COVID-19 activity on our website. And with the new interactive tool, it does also give you an opportunity to delve more into some of the questions that you might have. From a vaccine rollout perspective, as of today, we've administered 133,544 vaccines, making that 23% of the eligible population who've now received a vaccination. You know that last week the province moved us into phase 2 of their COVID-19 vaccine prioritization framework. This is the overall framework, as you remember, that gives us guidance and direction on the sequencing of populations within each phase. In other words, who gets vaccinated first within those phases. And on a day-to-day basis, the Provincial Vaccine Task Force does provide us with further guidance and direction on how to move forward. You will have seen information coming from nearby municipalities that they are moving ahead with different age groups and populations. You recall how I spoke about how some of the decisions that are getting made are becoming more and more targeted around the hotspot areas, around things that are possible or addressing issues within each community. And I know this can cause some concern or some confusion about why are we not doing exactly the same thing here? And there are several things that come into play. So one of them is about which tool we're using to do the bookings. So we opted to use the provincial tool. It meant a whole piece of the framework here for doing our vaccination program was taken care of by the province and allowed us to focus on other aspects of the program. Each area is also advised by a local vaccine task force. So these groups provide advice on sequencing based on our local understanding around community capacities, needs, opportunities, and of course on what the specific supply is for our area. So we do have that vaccine advisory network here or group here, as well as a broader vaccine advisory network that is made up of community members who give us advice about how to roll out the vaccine and helps groups to get ready with vaccination. We have been talking a fair bit about supply lately, and yes, we do have a steady supply, particularly of our Pfizer vaccine as we go forward, and a steady supply of vaccine of AstraZeneca that is rolling out mostly through the pharmacy route. But overall, our supply continues to be at a rate that doesn't allow us to open to, you know, the desired sort of rate of thousands of vaccines being administered today up into that 10,000 rate. So there do need to be choices that are made. There is sequencing that needs to be done. And we need to do that quite thoughtfully. So very encouraged by the demand around vaccine. This is great because we have seen with some of our populations as we've moved through them that the vaccination rates, had plateaued more so around the 60 or 70%. And so very much glad to see that there is a significant demand for vaccines, and everyone in our community will be getting a vaccine. We're working hard to administer them to our most vulnerable populations. So we're still doing that sequencing to make sure those at risk are vaccinated first. And we're working with our local hospitals, our primary care providers, our community groups to identify those people and the best way to contact them and administer a vaccine. So everybody is working very, very hard. Our call center is having situations where they're overwhelmed and people aren't able to get through. And we appreciate the frustration that goes along with that. But please do understand everybody's working very hard to please be patient and to remember to treat each other with kindness as we go through this stage. So just to highlight some of our populations and where we're at. So our continuing populations from phase 1 of the framework go on. So our healthcare workers that are being sequenced are target age populations, which we're continuing to hold at 60 plus age for those that are being vaccinated through the mass vaccination clinics, large scale clinics, 55 plus for those that are able to go to pharmacies and be vaccinated there. Also our adult Indigenous population here in Hamilton, seniors who are in congregate care settings, which includes 2 essential caregivers for each, adults who are recipients of chronic home care, and that's as defined by our local health integration network. And as well, we're working with those who are actually in hospital at the moment who are 60 plus to make sure that they're getting the vaccine as well. In addition to that, as part of our phase 2 populations, we're working to get the vaccines out to our hotspot areas, so postal code areas where we're vaccinating those that are 50 and older. So only in Toronto right now are they vaccinating those that are 18 and older. At present, we're at 15 and older, and this is going to continue to evolve over the coming weeks as we move forward. Our homebound individuals are being vaccinated. They began, thanks to our EMS, our paramedic colleagues, they began to be vaccinated on the weekend. And these are people who are identified either through, again, home care or through their primary care physician who are homebound and needing that type of support to get vaccinated. So just a pause there to remind you that anybody who can leave their home to get vaccinated, that's what these large-scale clinics are for. And so only for those who have significant challenges in getting out to get vaccinated, either because they live in a retirement home or a long-term care facility, that sort of place, or those who are homebound would get the direct delivery where they live. We're also working with our local hospitals and doctors to identify individuals who fall into the highest risk health conditions category to arrange for vaccination. And we'll be working through the high risk population as well, those with a high risk condition. So we are working with them to identify them. The province is actively working on how they can help to support that. And so you'll hear more updates as we go through this week, but know that we are working with those groups to get them in to get vaccinated. We're also working this week around special education workers here in Hamilton. We're eligible for vaccination of those groups. And once there's further information about that, that will be shared. All teachers at this point are not prioritized for vaccination, but here in Hamilton, but particularly special education workers are. So just in general, just hearing from our healthcare partners, you heard from our hospital partners last week about just how much strain is occurring within our healthcare system and how critical the situation is right now with the pandemic. Our case numbers, our outbreaks continue to increase in Hamilton, and we have this growing number of cases that are screening positive for variants. These variants, just a reminder, these do spread more easily and they make you sicker than the original variant that we were dealing with. And so this is why we're both much more concerned about it, as well as seeing these higher numbers of people who are hospitalized and in the ICU at younger ages here in Hamilton and across the province. So working together to stop the spread of COVID-19 and the variants is absolutely critical. We know people are tired. We know there are frustrations, but as you continue to see with the scope and scale of what's happening in our province in terms of cases, hospitalizations, people in ICUs, this is very concerning, and it's really important that we pull together to make sure that we're protecting ourselves, our loved ones, and our community as much as possible. So as the mayor said earlier, staying home if you're at all having any symptoms that could be related to COVID-19, and as we come into allergy season, that's going to make more people have some of those symptoms that are of concern. Going out and getting tested if you have those symptoms, but not going out for any other reason, if that's whether it's essential or not, if you have any of those symptoms. Limiting gatherings to only members of your immediate household, so no one beyond. Paul talked about some of the things that unfortunately did go on in the community over the weekend, and as you heard, our bylaw officers are out to help to curtail those activities if they do occur, but really calling on everybody to use the caution and the restraint that is really important to keep everybody safe. So I will just leave it at that, Mr. Mayor, and turn it back to you.
Thank you, Dr. Richardson, and thank you, Paul. And as you may realize, since we were talking, the Premier has made an announcement that the schools will remain closed for an indefinite period of time once the April break is over. So no going back to school after the April break, which is this week. And that certainly will have its impact on those that are attending school, but certainly also, I guess, I'm sure, an opportunity to minimize the spread of this virus, and we are seeing more and more cases in the school settings as well. So tough decision all around as well, not only last week, but now this week. And certainly we encourage everyone to get vaccinated as soon as you're eligible. I was fortunate enough to get vaccinated. My wife and I, both of us were fortunate enough to get vaccinated over the weekend. We booked on the provincial online booking portal, and we had good success. And I know for some people it's a little bit more challenging, or they get a busy time. Just stay with it. It's an easy process to get through, and you can book a location of your choice of our available vaccination centers. And the process itself was as easy as it could be. Friendly people letting you in, directing you where to go, making sure that everything is sanitized and clear and that you're healthy and safe when you leave. So thank you to all of those that are manning our operations, vaccination operations centers. They're doing a terrific job, and I get nothing but good positive reports from everyone in our community. And, you know, the best thing that you can do for your community, for your family, for your friends, your neighbors, is to get vaccinated when you're eligible. That is going to be the best way for us to get back to some sense of normalcy as soon as we can. Even though supplies remain limited, we are doing everything possible to ensure that what supplies we do have gets into the arms of folks that are eligible to get the vaccine. And ultimately, everyone that wants one is going to get one. But maintaining those prevention measures is going to continue to be important. So staying at home as much as possible, not engaging with other households, all of those very difficult things as the weather improves. Try and do as much as you can in a safe way outdoors and get that exercise, but maintaining that physical distancing and masking is still going to be critically important, even if you've been vaccinated. And now, you know, 120,000 plus citizens in Hamilton have been vaccinated. They are still required to mask and physical distance and all the other measures, because they could very well still be a carrier of the virus that can infect someone else, even though they may not be impacted by it. So thank you all for your ongoing efforts to keep doing the good work you're doing out there. And again, I think the lion's share of our population is doing exactly what they need to be doing, as frustrating as it is. The more that people follow those recommendations, the better off we're going to be, the less impact we're going to see in terms of people's health, and the less impact we're going to see in our healthcare system, which is strained right now, very much strained right now. And I think the overflow capacity is being set up, and hopefully that'll be functional, but never good news when elective surgeries have to be canceled to make room for some of the more serious COVID cases coming into hospitals. So not good choices, but the reality is it's happening, and we need to deal with it. On that note, Jasmine, I'm going to turn it back to you and invite our media to ask questions.
Great, thank you, Mr. Mayor. We have 6 media joining us today for the media briefing. We'll start with 1 question and 1 follow-up for everybody. First question will be to Lisa Pileski from CHML. Lisa, you can go ahead.
Hi, thanks very much. I hope you can hear me okay. Just wondering, as the mayor mentioned, that Premier Ford did announce that schools will be closed after the spring break. Just wondering if I could get your take, Dr. Richardson, on the situation in Hamilton schools. I know we've had, before the break, there were a lot of outbreaks in schools. I'm just wondering what you had been seeing and what your concerns were.
Thanks, Lisa. So, you know, this had been something we were watching very closely as we were coming into the spring break, and why we had indicated to our school boards that we would want them to let their teachers and their families know that there may be a need to pivot to online learning, depending on what we continued to see. And so very glad for this announcement today. So there's some consistency across the province in what is going to happen. So we had, you know, been seeing increasing numbers of cases, as you know, across the community, and that was getting reflected in our schools in terms of the numbers of cases. We didn't see, well, there were a number of outbreaks. We didn't see a lot of transmission. These were not large outbreaks that were affecting our schools, and again, really seemed to reflect what was going on in the community, with some transmission in schools, but limited and nothing very different from what we see elsewhere. So we do know that from an operational standpoint, these are very challenging. We take a very conservative approach when it comes to managing cases in schools. So that means a lot of students being asked to stay home and quarantine while testing is done and while there's follow-up. We also are asking the same, of course, of teachers who are sometimes in those classrooms, or others that are on the bus with them. And so operationally, it's becoming very challenging for the schools to manage. As well, you know, we were seeing the impacts that has on our own public health staff in terms of managing all of these people who are isolated, and the just going over each outbreak and all of those sorts of things too. So becoming difficult for us to continue to track, and the impacts it puts on all of our operations. So those were the main issues we were looking at, the concerns we had. you know, at this point, as cases continue to increase in the province, making a call that there's consistency across the province, this will be a good thing, be a good chance to hopefully break chains of transmission that may have been occurring in different ways, and a good chance for people to focus on being at home, doing the things they need to do. That said, we know that there's impacts on students, and that this is by no means something that doesn't come without another side of the story. And so hopefully we'll get case rates back down. This is part of the reason why we need everybody to do the measures that we're talking about, because having our kids in the schools is a very important part of what we need to do, and why schools should be the last things to close and the first things to open back up.
Thanks very much. And my follow-up would be for actually Paul Johnson. Just wondering about, in terms of the enforcement, you were saying that there's been a lot of private gatherings over the weekend. We also were hearing from listeners who were concerned. They were witnessing things, but they didn't feel comfortable kind of giving their information to bylaw, I guess, because, you know, if it ends up going to court, you know, they may, you know, they're going to be identified perhaps through the reporting process. So just wondering if there's concerns about even further gatherings going unreported because people are hesitant to kind of snitch on their neighbors.
So I think in some sense you could say that what we do find and what is reported to us is not the sum total of what's going on out there. So I'm sure there are other gatherings that are occurring here and there, but I would say that it is the minority and a very small minority that is choosing to very brazenly hold gatherings, the birthday parties, the baby showers, the celebrations that we all want to get back to. The people who are doing this and doing it at scale are they're the minority in our community. And I hope they'd start to reflect on that, because sometimes I hear, oh, everybody's doing it, so it's okay. And everybody's not doing it. And so convincing yourself that it's okay to do because everybody else is doing it is a very false narrative. That's not what's occurring in our community. Many people are forgoing those opportunities and painfully having to, again, for another year, not have those birthday celebrations, those anniversary celebrations. You know, as we tip into, you know, month 13 and 14, we're all going through it a second time. So I think that, yeah, are there probably some happening that we're not getting to? 100%. We can't be everywhere across the entire city of Hamilton. But to those who get a bit of the sense that, everybody's doing it, so I'll just get on board and what have you, that's not the case. I talk to many, many more people that tell me the stories of how they and their families have had the same hardships that all of us are going through in terms of not getting together and longing for that to happen. And their question that they keep coming to me with, and I know would be the same for the mayor and for Dr. Richardson, is when can we get back to getting together for a birthday party, celebrating an anniversary? And the answer is that's still a little ways off. But we do see the end is in sight. And so my hope is that we can, you know, stop wasting resources on things that are pretty easily identified as what we shouldn't be doing. Let's do fewer of those things. Our officers can be doing better things with their time. And also our community will be a lot safer, because these are higher risk activities at this particular moment. And we need to curtail them as best we can.
Thanks, Paul. Next question to Christine Rankin from CBC Hamilton. Christine, you can go ahead.
Hi there. Thanks for taking my questions. My first one's for Dr. Richardson. On Friday, the city expanded to include 3 more hotspots that weren't identified by the province despite public health recommendations. And I'm wondering if you can touch on differences that are coming out of the fact that the city made the call as compared to the province. So what is the impact on city's ends of things, like staffing, allocation of resources, that sort of aspect?
Thanks, Christine. So in terms of identifying those hotspots, these are areas that we're going into or making more plans to go into in terms of vaccination clinics and applying that 50+ age range to that group, those groups. So that is where a lot of our mobile clinics are going to be targeted over the coming weeks as we move forward. So just to explain a little bit about why the difference between them, we use slightly different factors in our analysis. The province used factors that would tend to identify things that had happened in the first and second wave, which led to identifying places where there were more people who were older and would have suffered those consequences of hospitalization and deaths. Absolutely, those are important in the analysis. We used the case rates and percent positivity on tests and had our analysis go further into this spring. And so that tends to look at where transmission is happening now in our community. And so as we're looking at this, and we already have good vaccination rates in our older population, but have ongoing transmission that's happening amongst our younger population, and where we're seeing more deaths now as we move forward. That's why we wanted to see those hotspots included in our vaccine rollout. So that's what we're working on now.
Okay, thanks. I'm also hoping to ask a question about the schools moving to remote learning. And I'm wondering, Dr. Richardson, what advice you have for families who are juggling remote learning next week, but also need to get the kids outside, especially for mental health reasons. But on top of all of this, there's a stay at home.
Absolutely, Christine. It's such a challenging time right now to be a parent. We know that's part of the pressures that they're experiencing. Many of them are continuing to work, and that's great that they're able to do so, but they're then having to juggle issues in terms of supporting their children with online learning, doing their own jobs, and then trying to figure out how best to, as you said, keep your kids healthy as we're moving through this from both a mental and a physical standpoint. So the getting outside piece is a big part of that. And so getting outside is a safer activity, of course, to be doing that just with your family members as you go forward and taking advantage of the opportunities that are there. Hopefully with the good weather, that will be easier to do. And a very important part. Of course, you don't necessarily want to add more online time to your children's day, but also still connecting with others is a very important part. So being able to connect either through that online learning or being able to connect still with friends in virtual ways rather than connecting with friends one-on-one or together, even if it's at the parks or elsewhere, that is the better way to do it at this point. But finding different activities, these are those things. There was a wonderful group that joined us from were children's mental health professionals that joined us at a former town hall. So it's a great time to go back, take a look at that, see there were lots of tips that they had for getting through this phase. And so just some ideas that are there for families as they're moving through this break and through the next several weeks.
Thanks, Dr. Richardson. Next question is to Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Thanks very much for taking my questions. I believe both mine are for Paul. You mentioned about charges being laid at events like baby showers and birthday parties and other gatherings. Do you have a sense of the number of charges that have been laid, whether that be just over the past weekend or past week for those sorts of things?
I do. Let me pull up what those numbers look like. 29 violations under the Reopening Ontario Act. So those would be a variety of things. Those may be more of outdoor activities. 47 charges laid at residential properties. So 47 in those types of gatherings that you talked about. So that is significant. And also when you balance that off against what is a good news story in the last week is zero commercial charges, although I know that's a little easier because it's pretty hard to sneak by these days with everything shut down. But 47 charges laid at residential properties.
Thanks. And you also mentioned about people are warning people not to call 911 to report infractions. So are people actually calling 911 to tell them to complain about parties? Like what's happening there?
So thankfully, rarely, but it has occurred. And so it's a constant reminder that yes, we want the public's help, but the public's help is through the city's phone line, the 546 city number, not through 911. So it is not a problem where it is creating that challenge. But as you can see, the number of residential infractions is going up. The stay-at-home order may bring more of this these calls coming obviously from a private residence perspective, so more of the public coming in, a little less easy for us to be proactive in these because they're in residential places as opposed to our proactive work we do with businesses. So it's just a reminder again, it's not something to worry about. It is certainly not jamming our 911 call centers to have them not be able to respond to true emergencies, but always a reminder that even though people may feel it's a very urgent matter and needs to be addressed, it's never in terms of any of our bylaws or the Reopening Ontario Act, those are not things that would rise to the level of calling 911. Just call the city and we're pretty quick to respond as they come through.
Great, thanks, Paul. Next question will be to Manisa from CHCH. Manisa, you can go ahead.
Hi, thank you for taking my question. My question is actually for Paul Johnson. What are some, with it being spring break, what are some safety tips parents and kids should remember?
So I think you heard Dr. Richardson talk a little bit about them. And the one big safety tip is stay within your family. This is not the time to expand and say, oh, well, just a play date here or a play date there with another family. So this is about family time, and that's the important piece. Getting outside for exercise is great. You know, there's lots of things you can do for exercise indoors, but we are at a temperature point now where it's not ridiculously cold, even though the rain's come down a little bit. So I think getting outside is that piece. And then, you know, as always, it is following all of those public health rules as you go and do things. So plenty of hand washing, particularly with children. Let's get them in the habit of hand washing. Trying not to touch their face as much, mask wearing where children are able to, whatever ages they are. So I think it's those things. This is a time where safety means spending time with your immediate family. I think the big message that I would send out, and I'll ask Dr. Richardson to fill in any gaps that I haven't covered, but the one big thing is, you know, as much as it would be tempting to get together with extended family or get together with a neighbor and their kids, remembering even outside, the risk is not zero, the risk is just lowered. And so it's really a chance, I think, for people to stay within their own household. That will be the safest piece. And obviously, the less travel, the better. Stay within your neighborhood. Go do things that are fun within your neighborhood or a little bit outside your neighborhood. But this is not the time to be traveling all over different cities trying to find different places to go. There's a chance to do some indoor activities. The one thing I'll say is, from a boredom perspective, if the temptation to do less safe things is because of boredom, there are lots of great online resources. The city has some of those online. Other organizations have created online resources with lots of great activities and new activities that you can do as a family. And so I'd encourage people who are maybe saying, geez, we've sort of run out of ideas in our own mind, go online and look at some great tips for crafts, for recreation, for games that people can play and enjoy each other's company. And we understand how tough this is going to be through this next period of time. But those are some of my pieces. Dr. Richardson, anything else you wanted to add there?
I think you covered it well, Paul.
And with kids going to playgrounds, what should parents be careful of?
So at playgrounds, the City of Hamilton playgrounds, we do ask that when you're there, you wear masks. And so again, unless you're in the exemption areas, which would be, very young children under the age of 2, or anybody who can't wear a mask. But again, those are very small in numbers who can't wear masks. So we're asking people to wear masks. So my expectation would be, if I'm driving around and looking at our community, that everybody in our playgrounds would be wearing masks. And the reason for that is it's really hard to guarantee that you're going to keep that 2 meters of separation, particularly when kids are playing at playgrounds. And then, of course, adults may, say hello to one another and not gather, but just say hello, and you may pass or something, and you're within that area. So we have signs. There should be signs at all of our playgrounds. I know some of them have been damaged and defaced a bit, but we're getting them up, and we've had them up for a while, asking people to wear masks. It's really become a lot more of the encouragement whenever we're outside. I suppose the exception if you're just wandering in a big field by yourself, it's not so much of a risk, but in all other areas, wear a mask. It's just that extra layer of protection. And I think for families getting out, there's going to be people in the parks. it's unlikely you're ever going to go and find the playground completely empty at all times of the day. So yeah, wear masks. And then the other piece is, we might want to bring wipes. Hand sanitizer is a portable piece so that you can constantly be cleaning hands as you go. And then of course, when you come back home, everybody washing their hands before they do any other types of activity, so that anything that might be there is taken care of when they get home.
Thanks, Paul. Next question to Maria from the Hamilton Spectator. Maria, you can go ahead.
Thank you very much. And thank you to the mayor for the kind Ramadan wish. I hope you're feeling well after your vaccination. My questions are for Dr. Richardson. I was wondering if you could touch a little bit more on those people who are eligible by virtue of their medical conditions. And I know you gestured towards other public health units that are doing different things. And I'm wondering, like, for example, Peel and Toronto, they both use the provincial portal, but for health conditions, they are using their own booking system for that. So I was wondering if you can just touch on how the process is working in Hamilton and why we are not using a system similar to those other public health units.
Thanks, Maria. So absolutely, each health unit, this is a population where each health unit is trying to figure out what works best in their community. So you can imagine with Peel and Toronto, they're very large populations. They're working it through in their own way. You'll see here, we've been working through with a group that's brought together across the hospitals that supports the people who have these chronic conditions. These are people who have transplants, they're people with severe cancers, they're a number of different groups, people on renal dialysis who are this highest risk group. And so we've been working with the hospitals to identify who those groups are, how they could be have their vaccine administered. You'll know that particularly for those who are on some form of treatment, there's a real discussion that needs to happen between their treating specialist and the person to talk about when exactly that vaccine should happen. So we're definitely working that through with those groups, and they are sorting out how best to deliver the vaccine to people who are in those groups. The group that have Down syndrome as well, we're working with our congregate settings, those that support people with developmental challenges, to look at how best to bring people together and reach people who have that particular condition. So that's how we're working it through here in Hamilton. As compared with others. We do know as well that the province will be is working on other ways they can support vaccinating these particular first groups of highest risk individuals, and then of course there's going to be moving through others with who are at risk in terms of health conditions. Sorry, Maria, my tongue's getting in my way today, but so that's all being rolled out as we go.
Thank you very much. And I'm wondering, because Dr. Richardson, you also provided an update to Council not long ago about vaccine supply, and I'm wondering if there's been any updates since then. You had mentioned at the time that the city had enough to maintain current capacity, which was about 3,000 doses per day. Has anything changed on that front? And if not, are we able to vaccinate, like those highest risk with their health conditions, if their doctors say that they are good to go, are we able to successfully deliver those vaccines to them now?
Thanks, Maria. So this is part of the reason why there is this sequencing, and we need to work from the standpoint of risk with people in our community and be vaccinating those that are at highest risk. So from the standpoint of supply, we had about 16,000 doses of vaccine that came in last week, and we administered just over 16,000 doses of vaccine. And so we do keep a small reserve, a quite small reserve, just in case we, a vaccine shipment is delayed. We don't want to end up in a situation where we're having to cancel appointments for those vaccine clinics as we go forward. So we just keep a small cushion of a day's worth, or sometimes even less than a day's worth in case that were to happen. Overall, we're vaccinating about 1,700 to 1,800 per day in the large scale clinics. So that's the HHS Clinic St. Joe's and the First Ontario Centre Clinic as well. We are doing those targeted clinics that are happening in the hotspot areas. You'll know as well the paramedics are doing the work with those that are homebound, and we are allocating vaccine to go towards those who have these high-risk chronic conditions. So all of those groups are having vaccine allocated to them and a way to get to them as we go forward. And then also trying to look at how do we work forward with the rest of the phase 2 populations as we go. So there's a lot of consideration that goes into it, and as we work through the supply challenges and best ways to reach people as well, it's a lot of logistics, but that's how it's rolling out right now, Maria.
Thanks, Dr. Richardson. Our next question is to Phil Perkins from CHCH. Phil, you can go ahead.
Hello, sorry about being late and messing up the feed. That is my fault. I'm going to get to it. We're vaccinating people in hotspots 50 and up. We're following provincial guidelines. But I see York region's already at 45 and up. They seem to kind of do whatever they want. Is Hamilton capable of doing that if we seem to eat into the 55-year-old bracket or the 50-year-old bracket?
Thanks, Phil. So the approach with hotspots, each community is working through vaccinating those hotspots as they go forward. The province has indicated that if they're able to get a good level of coverage of those 50 plus in those hotspots, they can begin to look at reducing the age. York actually sits with its own system, as I understand it, for doing bookings. And so they're moving through that through their own system as they're able to do that.
And is Hamilton capable of keeping some vaccination centers open 24 hours a day?
Thanks, Phil. At this point, we wouldn't look at 24-hour-a-day use. That's been talked about a lot in the province and something that's really been set aside some time ago in terms of 24-hour operations. We do have long hours that cover a good portion of the day to accommodate people who work overnight or people who go to work early in the morning or work late into the evening, so that there's times we work 7 days a week to make sure that there's lots of availability and flexibility. And given the supply we have right now, really, even if we were to get much more supply, we could still run those through the clinics the way that they're operating today. We're always looking at both a combination of availability, and so really we have a good slew of day, like all the days and hours covered, but also efficiency. We need to operate these things in an efficient way, accountable for the taxpayers' money.
Thank you, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today, so we'll pass things back to you. We'll just get you off mute there, Mr. Mayor.
Okay,
There we go.
did. Thank you. I did use my button. I just got to tell you. Thank you, Jasmine, Bill Custers, the entire team at Cable 14 and Clear Cable for your ongoing effort to make sure that we have very smooth and very important information sessions here shared with our community. So thank you for that. And to our community at large, thank you for continuing to stay at home as much as humanly possible within your household. Connecting with loved ones virtually on video chat or over the phone is the order of the day. And I know that takes us back to, many months ago when we were in a similar lockdown that was effective, and it did reduce the number of cases that we were having in our community and did prevent an overtopping of our healthcare system. So that's the objective right now. Do check in with your neighbors, especially elderly neighbors, make sure they're doing okay. And if they need anything, please do help them out. And as you could, shop local as much as possible. Visit our BIA's webpage or our hometownhub.ca to connect with and support the amazing businesses in our community that continue to operate, are not open, but continue to provide their product available to you through curbside pickup. And as always, for more information on COVID-19, the financial supports and any updates, visit our website at hamilton.ca/coronavirus. Lots of important information there regarding the virus, regarding the vaccine, regarding the help and supports that are out there for you financially and otherwise for individuals and businesses. All very important opportunities for you to help you get through these very challenging times. And on top of all that, we are going to be back here next Monday, April the 19th at 3 p.m. And in the meantime, continue to follow those public health measures and prevent the spread of this virus, and look after one another, be kind to one another, be patient, and we will get through this together. Thank you.